Did you know that right now, millions of older adults in the United States are quietly losing something incredibly important, something they have earned after a lifetime of work and contribution? I'm not talking about small matters. I'm talking about something that could decide whether you receive full medical care or end up paying tens of thousands of dollars out of your own pocket because of one small detail no one ever warned you about. Yes, I'm talking about Medicare, the federal health insurance program for people 65 and older. At first glance, it seems simple. If I have Medicare, I have health care. But the reality is far more complicated, and that complexity is exactly what causes so many people to fall into the trap of missing out on what is rightfully theirs. Imagine this. One morning, Mary, a 72-year-old from Texas, goes for an eye exam. After the checkup, the doctor tells her she needs new glasses to maintain her vision. She smiles, believing Medicare will cover the cost. But at the checkout counter, she receives a bill for nearly $500. Shocked, she asks, "Why isn't Medicare paying for this?" The clerk simply replies, "Your plan doesn't cover it." Mary had no idea there were other Medicare options that could have saved her that money. Nobody had ever told her. And when she finally found out, it was already too late. Her story is not unique. Each year, millions of older adults face the same shock. They discover the gaps in their coverage only when illness strikes, when medication is urgently needed, or when they are hospitalized. That's when they realize Medicare is not the all-inclusive protection they thought it was. According to the Centers for Medicare and Medicaid Services, more than 17 million Medicare complaints were filed just last year. Most came from people who had never been properly guided or who had chosen the wrong plan. The danger is that Medicare quietly changes every year. Benefits can be cut, prescription drugs may suddenly disappear from the coverage list, or certain services may no longer be included. These changes are hidden inside documents hundreds of pages long. How many people over 70 have the patience or the eyesight to read every word? That is why millions of seniors unknowingly lose benefits they deserve. Isn't it ironic? After a lifetime of paying taxes and contributing to the system, when you finally need protection the most, you don't get the full benefit. Not because the system doesn't exist, but because no one reminded you, no one explained it to you. Worse still, many private insurance companies that partner with Medicare have little incentive to make sure you know everything. Why? Because the fewer benefits people use, the more money they save. They are not breaking the law, but their silence comes at the expense of older adults. This is why today's video is so important. Medicare can be a lifesaver, but it can also become a sweet-looking trap if you don't fully understand it. Some seniors have been forced to sell their cars, cut back on daily expenses, or even take on debt just to pay for medicine. While the truth is Medicare could have covered much of those costs if they had chosen the right plan, the numbers are staggering. According to AARP, the average older adult in America spends about $6,600 a year on healthcare outside of what Medicare pays. That number could be cut in half if the right plan is chosen, or if applications are made for special assistance programs. Unfortunately, many people only realize this when their savings are already gone. But here's the good news. If you are listening to this, you are already one step ahead of millions of others. Knowledge is power, and knowing which questions to ask can help you protect your benefits. Before we go deeper, let me invite you to something small. If this is your first time here with New Golden Day, please subscribe. On this channel, we don't just share health information, we uncover the truths that others often fail to tell you. That is how your later years can truly become a new golden day, full and deserving. Now, let's look closer. Medicare is divided into different parts A, B, C, and D, each covering different things. And this complexity is exactly where the confusion begins. People believe everything is included, but often it's not. The most dangerous part is that this confusion can mean the difference between getting urgent care or facing a crushing hospital bill, between having long-term access to medicine or being forced to stop treatment because of the cost. This isn't just about money, it is about life and death. Think of Medicare as a large umbrella protecting seniors from the storm of illness and medical expenses. But that umbrella isn't one solid piece. It's made of many panels stitched together. If you don't know which panel covers which part, you'll find yourself exposed when you need shelter the most. Medicare is not a single one-size-fits-all program. Part A covers hospital care stays, surgeries, inpatient treatment. It sounds essential, but it is not completely free. There are deductibles and out-of-pocket costs. Part B covers doctor visits, tests, and outpatient care. This is the part most people must enroll in, but it comes with a monthly premium. Many retirees assume everything is free, only to be surprised when the monthly bill arrives. Part C, or Medicare Advantage, is where things get especially confusing. These plans are run by private companies and often bundle in extras like vision, dental, or hearing. It sounds attractive, but every company has its own rules, and it's easy to get lost in the fine print. Part D covers prescription drugs. This is the part many people skip and then end up paying hundreds of dollars each month out of pocket. As you can see, the system is like a house with many rooms. To enter each room, you need a separate key. Forget one key and you're locked out. This is exactly what happens to many seniors. They think having Medicare is enough, but they don't realize they're missing Part B or Part D. When they finally need a doctor or medication, they're denied coverage. A survey by the Kaiser Family Foundation found that 4 in 10 people over 65 admitted they don't really understand the differences between the parts of Medicare. That means millions of older adults are unclear about their own benefits. And here lies the painful truth. The older and weaker a person becomes, the harder it is to read and understand the hundreds of pages of paperwork. Picture a 78-year-old man with poor eyesight and trembling hands. Can he really sit and decipher the small print in a thick Medicare handbook? When he gives up, he unknowingly gives up his rights as well. This is not just a lack of information, it is information overload. Too many choices, too many conditions, too many numbers. Seniors feel overwhelmed, so they simply give up and think having Medicare is enough. But that very assumption can cost them thousands of dollars. It's like buying a car and being handed a 300-page manual. You don't read it. You just think a car is a car, it will run. One day, the car breaks down on the road. Only then do you find out there's a tiny reset button explained on page 157. By then it's too late. You've already had to call for expensive roadside service. Medicare works the same way. It protects you, but only if you know how to use it. And now we must go deeper. What benefits are seniors missing? Vision care, dental, hearing. These may sound minor, but ignoring them can open the door to enormous costs later on. Do you remember Mary's story from the beginning? The $500 bill for glasses that Medicare didn't cover. The truth is, she is not alone. Countless people are facing the same situation, simply because they don't realize they are letting their benefits slip right through their fingers. Some of these benefits may sound small, but when added up over years, the total can reach tens of thousands of dollars. And the frightening part is that most of us have no idea. Dental care, vision, and hearing, 3 of the most important things for maintaining quality of life in old age, are not covered by original Medicare, which includes Parts A and B. Only those who choose Medicare Advantage, or Part C, may receive coverage for these. And even then, many seniors never use the benefits simply because they don't know they have them. Think about it. A tooth extraction can cost several $100s. A pair of hearing aids runs at least $2,000 to $4,000. If you don't use the benefits, that money comes out of your own pocket. Then there's prescription coverage under a special program called Extra Help. This program was designed for people with low or moderate incomes. It can save you up to $5,000 a year on prescription drug costs. But here's the catch. It isn't automatic. You have to apply. And millions of people never do, because they don't realize they qualify. As a result, they keep paying hundreds of dollars each month for prescriptions that could have been covered. There are also home health and long-term care services. Many older adults believe Medicare only covers hospital stays. But in reality, there are options that include in-home nursing care, therapy, and rehabilitation. If you don't ask, no one will tell you. And when the time comes that you need help at home, you end up paying out of pocket, even though Medicare could have taken care of part of the cost. Preventive services are another area where seniors miss out. Medicare provides free screenings for cancer, diabetes, high blood pressure, and even vaccines. But too often people don't know about these benefits, so they never get tested until the disease is advanced. And as you know, treating advanced illness costs 10 times more than early prevention. Let me pause here to underline something important. No one has anything to gain by reminding you to use your benefits, except you. Insurance companies will not call to remind you. The government does not have time to personally check on each individual. The result of this silence is that you pay the price. A study by the National Council on Aging found that 2 out of 5 people over the age of 65 missed at least one important medical benefit last year. That means there's a real chance you or someone you love is among them. If you're listening right now and find this information useful, please take a moment to subscribe to NewGoldenDay. Every week, we bring you knowledge that can help protect your health, your savings, and your dignity in old age. So how do you make sure you don't lose these benefits? How do you turn Medicare from a maze into a true shield that protects you? That's what we'll uncover in the next section. Practical solutions you can take right now to secure your benefits. Medicare is not bad. The problem is that it's complicated, and the complexity causes people to miss out. The good news is that there are ways to take control, ways that put you in charge, instead of letting the system control you. First, always review your coverage during the annual open enrollment period, from October to December. This is your golden opportunity to check whether your current plan still works for you, or if a better one is available. Many seniors ignore this step, assuming nothing changes. But the truth is, this is exactly when thousands of benefits are adjusted. If you overlook this window, you may end up stuck in an old plan that costs more than it should. Second, don't be afraid to ask directly. Many benefits are only revealed if you ask about them, like home health care, the extra help program, or transportation to medical appointments. If you don't ask, staff will not volunteer the information. Sometimes one simple question, "Does my plan include this benefit?" can save you thousands of dollars. And remember, you don't have to struggle through hundreds of pages alone. Ask your children or grandchildren to help check online. Call your state's Medicare counseling hotline. Reach out to local nonprofits. Many have trained volunteers ready to assist. The key is not to stay silent. Silence means missed opportunities. Pay close attention to Medicare Advantage. Yes, it's confusing, but it also contains many of the benefits older adults need most: dental, vision, hearing, and prescriptions. Every company has different rules, so don't pick a plan just because of advertising. Compare carefully before you decide. Here's a small but powerful tip. Keep a dedicated notebook for your Medicare information. Write down your benefits, effective dates, and contact numbers. When you need something, just open the notebook. It's simple but effective, especially when memory isn't as sharp as it once was. None of these solutions are overly difficult. The only real question is whether we take action or not. There's an old American saying, "If you don't ask, the answer is always no." And what I want to emphasize most is this: Medicare is not a gift. It is a right you worked for all your life. You deserve it. So don't hesitate to protect it. We've talked about the fear of losing benefits, the complexity of Medicare, and the solutions to take control. Now, let's pause for a moment and reflect. Old age already brings many challenges. We face bodies that are no longer as strong, the loneliness that sometimes visits, and the financial worries that never quite disappear. In the middle of all this, we need one solid foundation. That foundation is healthcare. Medicare, when understood properly, can be a lifeline. But if neglected, it can become an undertow pulling you into hardship. The difference lies in knowledge, in whether you take the time to learn and to ask the right questions. I believe that after a lifetime of work, you deserve the best care. You have paid into the system. These benefits are not favors. They are your rightful rewards. Remember Mary and her glasses. $500 may not sound like much to some, but for her, it could have meant groceries, medication, or utility bills. And she lost that money simply because she didn't know. But you are different, now you know, and knowledge means power. Perhaps you're thinking, "I'm not good at reading contracts. I don't know how to use a computer. I'm embarrassed to call and ask questions." But let me remind you, no one cares more about your benefits than you. Every phone call you make, every page you ask a loved one to check, every question you raise, it's all a step toward protecting what belongs to you. Even more, when you understand Medicare and use it fully, you are not just protecting yourself, you are lifting a burden from your family. Your children and grandchildren will rest easier, knowing you are cared for and not left struggling with medical bills. That peace of mind is priceless. So, the deeper meaning here is this: it's not only about saving money, it's about protecting your well-being and your independence in old age. If you found today's message valuable, please subscribe to New Golden Day. Here we will continue to bring you the most important truths about health and benefits, so that every day of your later years can truly shine like a new golden day. And as we close, I want to leave you with one reminder. Never underestimate the power of knowledge. Never think you are too old to learn one more thing. Because knowledge, even one small piece of it, can change your entire life. You've already lived through decades 5, 6, 7, maybe 8. You've seen wars, pandemics, economic ups and downs. If you have survived all of that, then there is no reason you cannot move through the years ahead with the confidence that you deserve care, protection, and peace. Turn this truth into strength. You are not powerless. You can take control of your health future. And you are not alone. Because here at New Golden Day, we will always walk beside you